It's not easy to learn to feel comfortable in your own skin, especially if that skin is covered in scars. So we at Company decided to find out what cosmetic surgery would really involve. We spoke to the cosmetic surgeon Ian Whitworth about what would be involved to improve the appearance of the scar across my stomach.
See, the scar itself is really well healed, but the trouble is, this has all become a little bit tethered down. I can't get rid of the scar, but we could get rid of the consequences of the scar, and what you'd have to have is like a mini tummy tuck.
A flat tummy for the first time in my life? Sounds nice, right? But what's really involved?
Well, we do it under general anaesthetic, so we cut out the old scar, and then the overhang of skin we would actually pull down and see how far down we could get it. And once we'd done that and marked it, we'd cut out the normal skin below the scar to allow that skin to drop down to get as flat as possible.
And what about the risks?
Well, there's the risks really of any operation. The main thing I would worry about with this type of surgery is infection. So if you've got an infection in the wound, it took longer to heal, you may need antibiotics, and that would mean the scar probably would end up not as best as it could have been. Other things, bleeding, you would get some bruising and swelling. It'd be very unlikely you'd lose a large amount of blood, but the bruising again would take a few weeks to settle.
So what results could I expect?
It would be swollen, so immediately after the surgery you think, oh, it's made it worse. The scar would definitely be worse to begin with, because all new scars are red and lumpy, and so you look at it and think, well now, okay, I made the tummy flat, but I can see the scar more. And it may take up to a year for that to completely fade. Other problem is eventually you will have children. That may well change the appearance of the scar, it may stretch it. There's all sorts of issues you need to talk about and consider.
So after all that, I wouldn't be guaranteed a stomach to rival that of pussycat dolls. The risks just don't seem to outweigh the results. So girls, take note. Surgery is not the easy option. It is no magic cure. Instead, we are just going to have to learn to love ourselves the way we are and save a pair of Bridget Jones's knickers for those damn days.